A new study revealed some alarming statistics about the health of those who overuse marijuana. News.com has learned that adults who overuse cannabis are 60% more likely to suffer from heart failure, strokes or heart attacks than those of the same age and sex without cannabis use disorder, according to a new study. Researchers in Canada conducted the study on 30,000 people who have cannabis use disorder, CUD. The population-based group study included 5 health databases in Alberta, Canada. According to the study, published on September 28 in Journal Addiction, CUD is described as the continued use of marijuana despite negative effects on one's life and health. CUD affects approximately 27% to 34% of people who consume it. It's important to emphasize that these findings are observational, and they provide insights into patterns within our dataset. However, they do not establish a direct cause and effect relationship, lead author Dr. Anis Baji, at the University of Calgary's Cumming School of Medicine, told Forbes. Marijuana use has increased at a high pace in the past decade, with 55 million Americans saying they use the substance regularly. Cannabis has been linked to cardiovascular events, including heart disease, heart attacks and strokes because of the stress the substance can put on the organ. According to the Centers for Disease Control and Prevention, cannabis is also a mental health risk for those under 18 years, and younger people are more susceptible to developing CUD. Americans spend more on legal marijuana than they do on chocolate, according to MJ Daily, a Colorado-based business that reports on cannabis. Marijuana is legal at the federal level, and 23 states have legalized the use of cannabis. Despite the potentially alarming findings, researchers have noted that more information is needed to connect cannabis and serious health problems. Our study doesn't provide enough information to say that cannabis use disorder causes adverse cardiovascular disease events, but we can go so far as to say that Canadians with cannabis use disorder appear to have a much higher risk of cardiovascular disease than people without the disorder, Dr. Anis Baji, lead author of the study and assistant professor of psychiatry at the University of Calgary in Canada, said, according to the Daily Mail.